Hello, this is Queen Elizabeth. To quote Caudle and Langdon, on June the 28th, 2012, the United States Supreme Court issued its historic decision on the Affordable Care Act. The decision has been termed both a brilliant stroke of judicial legerdemain and the worst decision in the history of the court. We will let you decide. We are here live in the studio with nurse practitioner Ivan, old nurse, and nurse practitioner Penicillin, who are both here to answer your questions about the Affordable Care Act. Our first guest is Dewey Edom.
Hi, I'm a car salesman and I heard Obamacare puts a 40% tax on Cadillacs. Is that true? How am I supposed to make an honest living with a tax that high?
Mr. Cheatham, you have misunderstood the policy. Beginning in 2018, there will be a 40% excise tax on Cadillac health insurance plans. These are the high-cost health insurance plans. This means that as the cost of health insurance plans rise between now and 2018, and they most likely will, people who have more comprehensive plans will be penalized. The tax is on the insurer, but you can bet the cost will be passed on to the consumer.
Let me get this straight. What you are saying is that people who want to pay for better health care coverage will be penalized? I'm not a brain surgeon, but I am Queen. Ha ha. But isn't the Affordable Care Act trying to provide better health care and coverage to Americans?
That's the claim, Your Highness.
Well, I ain't gonna be able to sell any Cadillacs then, and that's too bad. I really like those cars.
Okay. Our next guest is Mr. Sparky, a Chief Engineer Officer from Enterprise Ships in Arizona.
Hello, I'm a small business owner. I have 58 employees. I've looked into providing health insurance for my employees in the past, and it was going to cost me thousands of dollars every month, 3 times what I personally take home every month as a paycheck. From what I understand, the Affordable Care Act will require me, by law, to provide health insurance for all of my employees, or I will have to pay a fine?
Yes, Mr. Sparky, that is correct. The employer mandate, which is part of the Affordable Care Act, becomes effective in 2014. It states that employers with 50 or more employees must offer affordable health coverage or pay a fine of $2,000 per person, or $3,000 if that employee obtains medical coverage through the exchange.
Are you okay, Mr. Sparky?
Yes, I'm just trying to decide which employees to fire. In this economy there is not much need for starships, and I cannot afford to provide health insurance for my employees, nor can I afford to pay the fine, so I must streamline my operation down to 49 employees.
I'm sorry to hear that, Mr. Sparky. There are part of the Affordable Care Act that penalize business owners, making it impossible to grow their business. Many business owners will be in your shoes, and as a result they will maintain a smaller workforce, which will hurt our economy in the long run.
Our next guest is Hypochondriac.
I'm 28 years old and I read on Facebook that there will be 35 million more people going to my provider's office and that I am going to have to wait years for an appointment.
Well, it is true that 35 million people will have access to healthcare that did not before, but they will not be all going to your provider's office. There will be nurse-managed health programs to alleviate some of the burden that this influx of patients will create. And the Affordable Care Act provides support for more advanced practice nurses through loan repayment programs.
No, they're all gonna want to go to my nurse practitioner. She is the bomb. She graduated from the University of Phoenix. I have to go. I will need a mammogram in 7 years, and colonoscopy in 27 years, and I need to call and schedule the appointments now.
Oliver Lusar is our next guest.
Dude. What's up? Is it true that I can stay on my parents' health insurance plan until I am 26?
That is true, Mr. Lusar. Under the Affordable Care Act, you can stay on your parents' insurance until you are 26 years old.
So I can vote, buy alcohol and cigarettes, buy a gun and father a child, or even get married, but I don't have to be a responsible adult and buy my own health insurance? I love America. Woo-hoo!
Everyone, please welcome Skip Skyper for our next guest.
Hey there, I'm a super Skyper and I just wanted to say how happy I am with the new technology the Affordable Care Act is going to provide.
Well, We are glad to hear some positive comments.
Yeah, I'm super stoked that with the electronic health records I can just Skype my provider and not even have to go into the clinic to see them. I can do everything right over my iPad. I love this technology.
Mr. Skyper, I think you may have misunderstood what the EHR actually means.
No, really. I read it on Facebook, and you know they can't put anything on Facebook that isn't true.
Mr. Skyper, I'm sorry to inform you that you are incorrect. You will still need to go in to see your provider. The Electronic Health Records aspect of the Affordable Health Care Act is a measure to convert all paper records into electronic form. Quote, certified electronic health records with decision support can prompt clinicians to implement evidence-based practices tailored to individual health needs. End quote. It also allows providers the ability to see the care that has been provided in the past, all in one location. This will help eliminate repetition of tests and reduce the overall cost of healthcare. The EHR will essentially allow your provider to spend more time in the exam room with you, and less on paperwork.
So I will still have to go sit in the waiting room. Oh man, I guess I better go download a good book on my iPad.
Next we have Idaho Bones from Indiana.
Hi, I'm a self-employed archaeologist who can find anything. My annual income is only $58,000 because Nazi soldiers from the 40s always steal my artifacts.
They are not your artifacts. They are mine. Idaho Bones is the one stealing the artifacts.
See what I mean? I can't get away from them. Anyway, we are a family of 4 and have never had health insurance because of the cost. How can the ACO help me to purchase health insurance?
Hello, Mr. Bones. Tax credits to help the middle class afford insurance will become available by 2014 for those whose income falls between 100% and 400% of the poverty line. The line for a family of 4 is $88,000. Therefore, your family could qualify to receive a tax credit and possibly a reduced cost sharing. Health benefit plans will be available through the Affordable Insurance Exchange.
Will I have to wait until tax time to use the credit?
No, you will not have to wait until tax time. To relieve you of financial burdens, the tax credit is advanced and will lower your premium payment each month. Working families will no longer be left without insurance. The ACA extends insurance to all and you will no longer have to choose between healthcare and financial security.
So what do you think about the Affordable Care Act, Mr. Bones?
Well,
How can I get this Affordable Care Act? It sounds great, and if Idaho Bones found it, it must be valuable and I want it.
Okay, let's say hello to our next guest. Alcoholic.
Hi, I'm Alcoholic. I own a small business and I was wondering if the Healthcare Act is going to put me out of business trying to provide healthcare coverage for all of my employees. Employees.
This is a great question. This is actually debated whether this will have a negative impact on small business. On average, small businesses pay about 18% more than large firms for the same health insurance policy because small businesses lack the purchasing power that larger businesses have. The healthcare law provides tax credits and soon the ability to shop for insurance in exchanges that help close this gap.
There is no way I can afford this. I have 200 workers and need to invest in my company.
If you have more than 50 employees, you will be fined for each full-time employee you do not provide insurance for, and the insurance premium must not exceed 9.5% of the employee's income.
This is dumb. I can barely break even now. I will have to cut hours for my workers to put time.
It is too early to tell exactly how small businesses will be affected. However, there are tax credits available to assist in the cost of health insurance. By 2014, small business tax credit goes up 50% for qualifying businesses. This will help with the cost of providing health insurance.
Our last guest is Albert Cash.
Hi, I'm an accountant. I would like to talk money today. Can you please tell me why the Affordable Care Act is called the Affordable Care Act when it costs $938 billion over the next 10 years?
Yes, the Affordable Care Act is going to be very expensive to implement. Taxes will go up as much as 9% for some individuals, and there will be a new 3.8% tax on unearned income. Unfortunately for businesses, taxes have to be built into their cost, which is then passed on to the consumer. They will most likely cut employment and try to run more effectively. Potentially they will purchase less supplies and equipment. All of this will limit the growth of our businesses and hurt our economy. There are also more taxes being placed on pharmaceutical and medical supply and insurance companies, so the extra cost to them will most likely be passed on to the consumer.
Actually, the cost of healthcare is estimated to go down. The Congressional Budget Office estimates that the cost of healthcare insurance will have a net cost of $1,168 billion for 2012 through 2022. This is $84 billion cheaper than was estimated before the Affordable Care Act was passed. Also, with primary health care being emphasized, the population will hopefully become more healthy along with untold savings through these new primary health care models.
Thank you, everyone. The Affordable Health Care Act is weaving advanced practice nurses into the community to accommodate the many Americans who will have health insurance. As nurse practitioners Penny Sillen and Divan Old Nurse know, nurse practitioners can provide preventative care, help reduce hospitalizations, build partnerships with patients and the community, and play a role in redesigning healthcare using electronic medical records. Though there are many disagreements about the policy, challenges of the Affordable Care Act must be met, and most providers will agree the time to collaborate is now if we are to help Americans live healthier lives.